Hey, good morning. I'm Vic Senese. I'm the host of the UroPatient podcast. Welcome to the show. We got a great show for you today, so join us now. All right, so today we're going to talk about something that's becoming very popular, at-home urinary tract infection test, or UTI test. But are they accurate? Can you rely on them? Well, let's find out. So let's start with the basics about what is a UTI. A urinary tract infection happens when bacteria enters the urinary tract. Now, most infections affect the bladder, and the most common symptoms are burning, urgency, and cloudy urine. Now, when a patient asks how to recognize a UTI, these are the most common signs. As I mentioned, burning or pain during urination, a frequent urge to go, feeling like you got to go more often or you got to rush to the bathroom. Cloudy or strong smelling urine. You know, sometimes certain infection, you can just tell from the change in the smell of your urine. Lower abdominal pain. Occasionally blood in the urine. However, not all UTIs show symptoms, especially as you get to be an older adult. And if you've had something like a catheter in, you may not know that you had an infection because of the irritation from that. Now, what are these at-home UTI tests, and where do you get them? Well, you can buy these tests online at the pharmacy. These are all the ones I'm showing up above here, are all from the Amazon. They look like simple test strips, and you dip them in your urine and match the color and changes to a chart. Sounds pretty easy, right? There's a little bit more to it, so let's talk about that. Now, how do they work? Well, they use two indicators, one called nitrates, the other called leukocytes. This helps suggest whether bacteria are present. But remember, not every bacteria produces nitrites, so false negatives can happen. And as I kind of show this easy 1, 2, 3, you dip, wet the strip for 2 seconds, lay flat on a paper towel, and read it. So it is kind of a 1, 2, 3, and you're out. But what's the accuracy of these tests? Do they really work? Well, the short answer, somewhat. They can give us useful information, but they're not 100% accurate. A negative test doesn't always mean you're infection-free. Actually, it detects the presence of nitrites, as I mentioned, which are produced by certain bacteria. Not all bacteria produce nitrites because it's breaking down a chemical in the urine that causes these nitrites. They're normally not present without that. And then leukocytes, well, that's the fancy name for white blood cells. White blood cells are how we break down or treat infections. So those are the things that are going in there and trying to gobble up those bacteria for you. So when you have an infection, typically you'll have more white cells present. And there's an enzyme from the white blood cells called leukocyte esterase, which we can test for with those test strips. And they may indicate an infection. However, once again, not all bacteria cause an increased white cell production. And it doesn't always show it early on, too. But when used correctly, some kits show about an 80 to 90% correlation with clinical lab results. But there are false negatives and positives that can occur. As I mentioned, not all bacteria produce nitrates, and improper sample collection or timing results can affect the results. While these tests can be helpful for screening, they should never replace a professional evaluation and a urine culture to provide accurate diagnosis and treatment. Urine culture is that test that we send out where we grow the bacteria out on a plate to see if there's bacteria growing. And then we can also test to see what will kill it. Now let's talk about those limitations for UTI testing at home. Technique matters. If you don't collect the urine properly or read the strip at the wrong time, the results could be misleading. And these tests don't tell you which antibiotic you need, such as a culture would, where they test to see whether the antibiotic is going to kill it. But as you can see from this color chart here, it's really a simple compare, dip it and compare the color that changed to that chart. And depending on how much change, we know if there's more or less positive leukocytes or nitrites, those two things that we look at. I kind of mentioned there's other things that we can look at. Some of those test strips that I showed earlier have 3-4 different things they test for, like pH. Not really used much to determine whether you have a urinary tract infection, but sometimes we could use it for other things. So, but leukocytes and nitrites are the two biggies that we want for infection. Now, despite their limitations, at-home testing can be helpful as a first step, especially for people with frequent infections and they're already familiar with their symptoms. So if you're one of these frequent flyers with UTIs, this could be a good way to kind of keep at-home monitoring for it. Also, it can tell you when you need to get professional help. You kind of have some symptoms that are getting worse. Your fever could be high fever, severe back pain, could be an infection spreading. So always make sure you contact your doctor if things are getting worse. Now, what to expect from a medical UTI test. So we use strips very similar. You may have seen them if you came in the office and noticed people dipping a test strip into the urine. Most of us use an automated machine that can read those things, probably maybe even more accurately than we can. But it's still, when we're really suspicious, we'll send the urine out for a culture to find out exactly what bacteria, because it doesn't tell you the exact bacteria and which is the right antibiotic to treat you with. Because if you can treat a person who's resistant to a certain antibiotic, it's not going to work. So we need to know that. Now, something that an at-home test just can't do. Now, here's the other thing, as we see here with this guy looking through the microscope. If we do a test in our office and we see positive for leukocytes and nitrites, the first thing we're going to do is look under the microscope, because you want to see, are there actually bacteria? We can see bacteria with the microscope, often see them. And the leukocytes, those white cells, pretty easy to pick out too on the microscope. Pretty easy for me. I've been looking at urines for 40 years, but it's a pretty classical thing. So we want to take a look at the urine under the scope, because it'll give you an idea better than just the test strip, or it might tell you whether the test strip was accurate or not. Now, maybe somebody's test strip is negative and they still have a lot of symptoms. Same thing, under the scope. That's the best way. Get a microscopic urinalysis on top of the test. But again, that involves an office visit or sending it off to a laboratory. And if it's positive, they usually follows up with that urine culture where we really grow things out. That's the best way. Now, here's some tips to get the most accurate results from your at-home testing. So always follow directions carefully. Read the labels and maintain clean testing conditions. Don't contaminate the sample because it could be affected. Always wash your hands and use a clean catch midstream urine sample to reduce contamination. So what's this midstream thing? Well, the middle of the stream is what we really want to look at, because that's the urine coming out of the bladder. The first part of your stream is what we call urethral wash. So it's kind of washing everything that's in the urethra, which may be a little less accurate than having that, stuff from the bladder. So midstream, go a little bit into the toilet first, then catch a sample in the cup for your test. Best time to test generally is first thing in the morning, and that's because your urine's more concentrated from sitting all night long. It increases the likelihood of it detecting infection markers. More leukocytes and nitrites in the urine, the easier it is to find it on that test strip. Now, be sure to read the color changes accurately and within the exact time window it tells you to check those out. Because if you wait too long or read it too early or bad lighting and you can't really see what you're doing, all going to affect the results. Now, here's another tip. Make sure you store them properly, because this test strip's got to be stored in a cool, dry place. A lot of moisture will affect the strips and they'll get inaccurate and start changing colors because of that. And they do expire. They don't last forever. Look at the label and make sure that it's still good. Finally, record your results and share that with your healthcare provider. They'll let you know whether they think you need to go on to have more testing or send off for culture or start treatment. So the best thing you can do is try to not get an infection And there are ways to prevent future urinary tract infections. It usually involves simple daily habits to keep your urinary system healthy and reduce bacterial growth. Stay well hydrated, drinking water. We used to tell patients if you drank enough water, you can usually flush an infection away too. So drink water, plenty of water to flush that bacteria from your bladder. And try to urinate regularly rather than holding it in. So try not to go for long periods of time holding your urine. For you females, if you're when you wipe from front to back after using the bathroom to prevent bacteria from spreading from the rectal area to the urethra if you went from back to front. So for sexually active individuals, urinating after intercourse can help clear bacteria that could be introduced during sexual activity. So you should always urinate afterwards. Avoid harsh soaps, douches, scented hygiene products, because those chemicals can irritate the urethra and simulate what urinary tract infection feels like. And really, it's just a chemical irritation. Choose breathable cotton underwear to minimize the buildup of moisture. If you experience frequent UTIs, talk with your healthcare provider about other preventative strategies such as lifestyle adjustments, maybe probiotics, and maybe some preventative prescriptions that you might have on hand. So to wrap it up, my final thoughts, I think the at-home tests have a process they can offer some insight. Done properly, they help. But don't self-treat based on those. Make sure you consult with your physician to be sure you're on the proper treatment regimen. And remember, they're tools. They're not a substitute for clinical care. So hopefully you found this helpful, and we'll look forward to seeing you next week for more great information on UroPatient.com.